Boris Johnson's government announced late last night that the NHS in England would get an extra £3 billion to prepare for a possible second wave of coronavirus. Dr. Layla McCay is a director at the NHS Confederation. Thanks so much for joining us. Money is always welcome. How should it be spent, do you think?
Well, I think that when we're thinking about how to prepare for a second wave, really we need to be making sure that capacity is at the top of all of our minds. So that's capacity both for potentially increased coronavirus cases and at the same time capacity for delivering other non-COVID-19 services. So I think that we're expecting it to be spent on things like accessing the capacity within the independent sector as part of the overall health system capacity. And of course, as we're hearing, maintaining the Nightingale hospitals in case they are needed for various purposes as the winter progresses.
We're familiar with the efforts that were made, and you mentioned the Nightingale hospitals and the use of independent hospitals. We're familiar with what was put in place when all of this started. Given we know how much more difficult the winter could be, will the measures, in essence, and I'm not making a joke here, will it be the same as spring but on steroids?
It could well be. We're hearing from our members, whether it's hospital CEOs, whether it's GPs, that a perfect storm is brewing. What we've got here is reduced capacity because of social distancing, because of having to look after people in COVID positive and COVID negative areas. We've got increased demand because of the people waiting for the routine procedures and other people who haven't even come forward to be diagnosed yet because they've perhaps delayed seeking help due to coronavirus worries. We've got people with increased mental health problems, increased rehabilitation needs after having had COVID-19. And at the same time of all of that, the flu, of course, could be a real consideration. And hospitals, GPs, nowhere is able to operate at absolutely full capacity because not just are they having the social distancing and associated coronavirus logistical issues, but actually they need to maintain that capacity in case there is a second peak, and we don't know how big that will be.
Thanks for talking to us, Dr. Layla McCay, Director at the NHS Confederation.